Good afternoon. Thank you so much for being here and listening to us. When I first moved to Florida 30 years ago, the state saying down here is, we don't care how you did it up north. And that part pretty much still stands. Although I will say, there are many things done better here than up there. I was in Massachusetts in August, and I was surprised to see the number, I've been here 30 years, so I was surprised to see the number of autism centers in and around the areas I traveled. Large, inviting buildings, nicely landscaped, very new, very well kept. And I wondered at that time how it was that Massachusetts seemed to have the funding for programs, services, and education for autism. And when I sat down to research this question, I was surprised to find that Massachusetts is often considered a leader in autism programs. So today, as you hear from the autism caretakers, parents, grandparents, great-grandparents, siblings, and so on, regarding their lives, their roadblocks, their fears, their frustrations, I wonder myself, why don't we have better things? And as I was reading about different autism programs offered in Massachusetts, I thought of my dad. And when I would ask for or wish for something, he would say, so how are you going to make that happen? Well, for us, maybe a closer look at Massachusetts can give us a start as to how Florida can someday make that list of leading states who offer great programs for autistic people. So with that being said, I'm going to give you a few key points about Mass autism programs. They have a high prevalence of autism. Massachusetts reports a higher rate of autism diagnosis compared to the national average. But not because there are more autistic people in Mass, but because primarily due to its strong healthcare system, robust awareness campaigns and early intervention programs, and comprehensive screening practices which lead to early detection and more accurate reporting of autism cases within the state. More children with autism are being identified and diagnosed because of the readily available access to services and heightened awareness about autism. Just to get a diagnosis from a neurologist, and I know you've heard this from other parents, here in Florida, my granddaughter had to wait 12 months for an appointment. Then 2 months before the appointment, they called to tell her they got to push it out another 2 months. 14 months just to get a written diagnosis so that we could start trying to get some kind of help. He's 6, he's nonverbal, not potty trained. Fortunately for her, she did find another source, and we're starting to dig through the muck and mire of helping. Massachusetts has enacted extensive laws requiring schools to provide individualized education plans tailored to the needs of autistic students, including addressing communication, social interaction, action, and sensory issues. While we have IEPs here in Florida, many are not implemented properly, due mostly because of lack of trained teachers, low pay, not enough staffing to oversee the students and their IEPs.
Okay, Linda, wrap it up.
I'm trying to hurry.
I know, you're doing great.
Medicaid also covers ABA set therapy. They also have an early intervention program. And they also now require state colleges and universities to allow children with autism, adults with autism, to attend these facilities. They're funded by, they also offer Medicaid waivers called the 1915C, so that people can have more help with Medicaid. And they also have passed 2 laws that require their insurance companies to cover a lot of the autism requirements. And that's pretty much what I've dug up.
Thank you, Linda.
Thank you.